Welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jennifer Dusablon, your host for today's show. Through this monthly show, we bring you information about the agency's programs and services and helpful tips to help you and your loved ones stay safe and healthy at home. Franklin County Home Health Agency is your local home health and hospice organization providing care since 1969 throughout the 15 cities and towns. Today we'll be learning more about the agency's home telemonitoring system. And to do so, I have invited a guest with me from Franklin County Home Health Agency, Susan Trombley, a nurse at Franklin County Home Health. Thank you for being here.
Thank you for inviting me.
Sure. So Susan, you're a registered nurse.
Yes.
But let's talk a little bit about what your specific role is at the agency, and then we can hear some information about what brought you there.
All right. I'm the chronic disease management coordinator. I'm also the LNA supervisor, but I run the chronic telemonitoring system for patients with chronic disease, congestive heart failure, COPD, looking to expand a little into maybe possibly diabetes.
Oh, okay.
Monitoring with our new system.
Oh, good. Well, we'll hear some more about that. So I'll back up a little bit and tell us about yourself, what brought you to a nursing career, and then what made you choose Franklin County Home Health Agency.
A nursing career is a second career for me. I used to be in the business end of things, and then I stayed home with my younger two, and then went part-time back to work as a unit secretary in the hospital, and just was fascinated by what the nurses did. So I decided to go back to get a nursing degree.
That's awesome.
Yeah.
That's
And then Franklin County, I was in a situation of employment that I wasn't happy, and had interviewed on the phone with Janet, and just really thought that this would be the best place for me.
Well, we're glad you came. How long have you been at the agency?
Been here since April of this year.
Wonderful.
So only a few months.
Yeah, good. So chronic disease management. Again, you were talking about congestive heart failure, COPD, all these things. Can you relate those to hospitalizations? So we use a term at the office or in healthcare, acute care hospitalization. What is that, and what's its impact on patient care?
So the people that I am more likely to manage are more likely to be re-hospitalized due to this chronic disease. It's a progressive disease that they can have exacerbations, meaning episodes of problems. So our telemonitoring system is hoping to try to catch some of these problems before they get so bad that they need to go into the hospital.
Mm-hmm. So it helps the whole healthcare system. If
Yes.
we are sending patients back and forth to the hospital, costs and
Right.
just quality of life.
Right.
So a lot of times we talk about in home care, you may be sick and you go to the hospital and you transition home, and we're there to help you get better and so forth. But you're talking about diseases that are chronic, so they're going to continue on. And
Correct.
And how does home telemonitoring help a patient with their own self-care?
So it makes them a little more aware of what they're eating. If there's because we do a daily weight, a daily blood pressure, oxygen saturations, and heart rate. So if they've gained a few pounds, it could be water weight. So they might need to evaluate what they ate. Did they take in too much water? Did they take in too much salt? That sort of thing. So that helps them to kind of be more aware of what they're eating.
How their food is
Yes.
impacting their condition directly. Sure.
Exactly.
Okay. I should, before I go too far about telemonitoring, which we're here to talk about, but just want to mention some of the other things that Franklin County Home Health Agency does to prevent those acute care hospitalizations. And this can be in people with many different kind of conditions,
Right.
but we're implementing risk assessments, checking out each individual's home or their situation and see what the risk is for going to the
Yes.
hospital. Emergency care plans.
Yes.
I'm sure that's make sure they're tailored to each individual. Fall prevention programs, and we've talked a lot on this show about fall prevention, and maybe I can ask you too how this might relate to falls. Telehealth, which is what we also call telemonitoring, improving medication management, I'm sure that's another one, and physician communication.
Right.
So let's talk a little bit about physicians and telemonitoring. I understand you do some demonstrations with physicians for this. What are they
Yes.
saying? What are they?
We haven't started with the new equipment. We will be, since we've put some in the homes and it seems to be going very well. We'll go and demonstrate to the to the physicians, to the PAs, to the nurse practitioners, to encourage people to maybe put this in their patients' homes to be able to maybe get a little better hold of everything for them. We can send trends to the doctor's offices, every couple weeks if there's an issue with people's blood pressures, their weights, that sort of thing. That's something that we have the capacity of doing.
Like a printed or
a printed,
electronic tracking record of what's been happening. That's really cool. Yeah. So let's talk a little bit really about like how this works. So, and I should mention, you just said the new equipment. The agency's had telemonitoring for many years now.
Yes.
We've been using a very cool state-of-the-art technology, but it's maybe a little more bulky.
Yes.
And it was something we have demonstrated on here before. It was a machine that's plugged in and connected to their telephone system and can run through all the same checking all the same data.
Right.
But we've moved to higher technology using these great little tablets.
Yes,
basically.
and these can go in people's homes a lot of people nowadays don't have landlines. So this either can run off a cellular service or a Wi-Fi. So that's a little more convenient for people who don't have the landlines or who have a landline that maybe isn't good with transmitting our data with our older machines. Then this one is perfect for them.
That's great. Are people are they accepting this new technology? Are you finding that
they are? I wasn't quite sure how, because a lot of our clients are older, so they're not used to this sort of tablet, whereas the younger generation is constantly used to that.
That's changing fast, though.
It is, but they seem to really like it.
Yeah.
It's a very simple process. It's touch screen, yes or no answers, prompts you and gives you enough time to put the blood pressure cuff on or the O2 saturation or to step on the scale.
Yeah. So it's easy. We'll demonstrate it in a little bit, but it's easy enough for someone living at home alone to manage. To do.
And we set an alarm per se of what time if they're early risers, we can set it for 6 a.m. It'll prompt them time to take your vital signs, and it gives them a little while to get there in case they're in the kitchen or the living room, and they're able to come and sit down and do their vital signs.
How long will it take someone to go through that?
It only takes probably like 5 minutes, maybe, not a long period of time.
Sure. So how is this different from before this existed? What was the impact on nurse visits compared to now?
Well, there could have been more frequent nurse visits just to get vital signs, whereas this is something that can be done. They're independent with it. I get this information directly to my computer.
So, and it's telling us something.
It is.
It might be a fun time to demonstrate it if it's beeping at us. So I will be your patient if you want to kind of show me some of what it can do.
All right. So, we're going to just do some vital signs.
Okay. So it's just prompting you there, and I think they can see it on the screen, so
Yes.
we'll talk about what's on there.
We're going to do your oxygen saturation and your blood pressure.
Okay.
Do you want to send your vitals to your clinician?
So it asked if we want to send it to your clinician.
And so we hit yes, and that'll come directly to me.
Okay. So they could do this and hit
Please
no.
turn on the oximeter and put it on your middle finger.
So this is the oximeter, and it's just an easy touch.
Oh, it's very light.
Yes, and this is all Bluetooth, so it goes directly to the.
So no wires to worry about.
This just every 400 and something checks it needs to be recharged, but the charger comes with the whole system.
About how long does a system like this stay in someone's home? How long is it?
It all depends on the patient and how if they're trying to adjust their medications, if they're trying to, it could be for a couple weeks, someone coming out.
Please remove the oximeter from your finger.
How am I doing?
You're doing good. You're breathing well.
Attach the blood pressure cuff. Press the start button on the device when ready.
All right. And so when we set these up in a patient's home, we adjust it so that they can just easily pull it on and off.
Okay.
So we put it on here, and then after they're done, they can just pull it off.
Oh,
Yep.
that's cool.
And then they just push the button.
Let's see if my blood pressure's high on TV.
Right, it could be. And so this is also a Bluetooth device that reads. That's battery operated, so just periodically we'd have to change out the batteries for them. And the scale can be either battery or plug-in.
Okay. And again, Bluetooth or?
Yes.
That's amazing.
Wireless. All Bluetooth directs right to the monitor.
That's really great. Does every person who has this have all of these components in their house?
No, some people might just need.
Please remove the blood pressure cuff.
You can just slide it right down. There you go. And then
it.
the next time you can
Your
just slide it
blood
right back.
oxygen is 99. Your blood pressure is 119 over 76. Your
Tells
heart
them.
rate is 65.
There you
Please
go.
remember to take your medications as prescribed by your physician and maintain the proper diet. Thank you for completing your vital signs measurements.
So it was reminding the patient to take their medicine.
Yes.
Are
Yep.
there other prompts that you might put
There
in
are other prompts depending on what they're doing. There's questions that we'll ask them. Having any difficulty breathing, any edema, any how are you feeling today? Are you more tired than you were before? Depending on what their diagnosis is, will be what we'll ask.
Sure.
And always the one that we ask on everyone is, would you like to hear from your clinician today? And so if they can answer yes to any of those things, I will give them a call.
Okay.
Or if any of their vital signs are an alert, then I will give them a call, and if they've gained so much weight, or their blood pressure seems a little high or a little low, or if their oxygen saturation is a little low, then I'll call and ask them how they're feeling, and we'll kind of make a decision about what we're going to do.
That is great. So now, do you do all those calls, or might you also have to send a nurse? And
I do the calls initially, and then if a nurse is needed to be sent, I will page the nurse and then discuss with her what was discussed with the patient, that maybe, could you go in and check on them?
It's a really efficient use
Yes.
of all the staff time and everything there. So a lot of the patients who might receive this, can you talk about, you've mentioned some of the conditions, but could they just be receiving this and no other home health services, a nurse as needed, or what's it look
It is
like?
part of a, so they still have to have the home health homebound status. But they might not be getting everything. Some might not get the weight. Some might just get the scale. So they can have any one of the products depending on what they're needed for.
Sure. So if they're already in home care, they may just need to discuss with their nurse if this is appropriate for their
Correct.
condition. If they are thinking, if you know a loved one or someone who might need home care, they need to talk with their doctor.
Yes.
And also see if this is appropriate, and that's remind us how people are referred to home health.
They're referred to home health typically either through their doctor or from being in an acute care setting.
Sure. On discharge, they would be referred.
They would recommend that, maybe we should monitor this person. Some people may be coming out with surgeries or episodes of pneumonia, anything like that, that maybe they need to monitor their oxygen or their weight or any of that sort of thing. So changing of medications with heart conditions.
Yeah. And that's when I was mentioning the fall assessment. I know that's one thing with medication management is big on preventing falls. And like you said, diet, you don't want to be dizzy, you don't want to be low blood pressure, prevent those falls as well. So it's tied into a lot of things there. Mention how many folks are currently using this in Franklin
Right now
County.
we currently have 22 and we have the capacity to do 30.
That's awesome.
So,
Of these new equipment.
15 of the new, and we still have 15 of the of our other equipment.
And which is great equipment
Yes,
too. So
absolutely.
we're happy to have both. And we're happy to have staff there who are on top of this.
Yes.
Right there. Like you said, it's literally sent to your computer.
Correct.
You can have real-time sharing. Now, not 24 hours.
Right. It's usually, people are usually do their monitoring first thing in the morning. I have a gentleman that gets up really early, so he's set early, and then some people are 9 o'clock, 10 o'clock. So,
everything happens.
and then some people can utilize it later in the day if they're just not feeling right. They can recheck their vital signs, and those will be sent to me. And I'll usually pick that up the next morning. So
yeah, excellent. So is there anything else you'd like to share before we close today about the work that you do, your team members or this equipment?
I'm just excited about it. I think it's a great resource to be able to help keep people out of the hospitals, to catch things early and maybe start developing plans to what to do instead of getting them back into the hospitals.
It's really proactive, not reactive.
Yes, exactly.
Absolutely. Well, thank you for demonstrating on me. I feel like I got my little checkup today.
Right?
I won't
Thank
take
you.
my weight, but it's nice to see that people can do all of this at home and have this state-of-the-art equipment right at their fingertips,
Yes.
literally. Again, I thank you for all the work that you do there.
Oh, thank you.
And before I close today, I just want to remind our community, first I want to thank you for your support of the efforts we have at Franklin County Home Health Agency. Your support makes these wonderful things happen, and we have qualified staff and great equipment because of our community's support. In that light, I want to remind folks that we are planning for our 8th annual Blue Jean Ball, which is our signature fundraising event, a dinner and silent and live auctions, and that's occurring on October 22nd at the American Legion here in St. Albans. So we've had some wonderful sponsorship support from businesses in our community, and we're also receiving a lot of great auction items. If you're a business or individual who'd like to talk with me about donating an auction item, I'd love to hear from you. So again, that event is October 22nd. It's our Blue Jean Ball, and this year we're going Fiesta as our theme, so you can dress up in your denim and come and have a little fiesta with us. Dinner by Santini Catering, so it's always a fun event. I also want to let folks know about some of our job openings. You can work with wonderful staff like Susan at Franklin County Home Health. We do have a staff accountant position, nursing, physical therapy, speech therapy, and occupational therapy positions, and care attendants. So if you want any more information about working at Franklin County Home Health Agency, we encourage you to check out our website, www.fchha.org, and you can find our job listings and information there, and you can also print an application to apply. You can also find information about our programs and services, more information about telehealth. You can view past episodes of Where the Heart Is, so we hope you'll check out our website. And like us on Facebook. Of course, you'll get lots of updates there as to what we are doing. So thank you for watching, and be well.